Good morning, everyone. I'm John Horgan, Premier of British Columbia. I'm delighted to be here on the traditional territory of the Coast Salish peoples, joined by Dr. Penny Ballum, the Chair of the Vancouver Coastal Health Authority, Natalie Meixner, the President and CEO of the Richmond Hospital Foundation, Dr. Richard Chan, an ER doc here and a newly minted foundation member, as well as my colleague, the Minister of Health, Adrian Dix. Over the past many months, many things have come into perspective for British Columbians. Front and center is our focus on ensuring that healthcare, publicly delivered, publicly funded healthcare, can be delivered in every corner of the province. That has been made more obvious by the advent of a global pandemic. COVID-19 has changed and transformed not just British Columbia, but indeed the world. And our success in British Columbia, compared to other provinces, certainly compared to our neighbors, our cousins to the south, is extraordinary. And it's the direct result of the people of British Columbia recognizing the challenge that we had as a community, recognizing that we all needed to work together wherever we came from, regardless of our means, to do what we could to bend the curve. And we have been successful and are very pleased to have moved into phase 3 of our restart plan just last week. But strong public services are really foundational to our success going forward. And now that we're slowly and carefully reopening the economy, we want to get back to making sure that we're talking about the issues that are important to British Columbians. 2 years ago, Minister Dix and I were at Richmond Hospital to announce the concept plan had been approved for a new tower, a new northern tower that would be the beginning of the renewal of the hospital here in Richmond. Well, over the past 2 years, working and listening and collaborating with physicians, with others that looked at the model, Dr. Ballum's work, to make sure that when we put the business plan to rest and made the decision to spend the money or put the money in the budget, that we would do it in a way that created a hospital that would endure decades for the people of Richmond. So I'm proud to announce today that a larger tower with expanded services is on the way. Once finished, the new tower will have nearly 220 new beds, bringing the total complement to the hospital to 350. People will have better access to care because of a new emergency department, a fully equipped medical imaging area, and another intensive care component, as well as pharmacy, pediatrics, surgical, and mental health services. Far larger, far grander, far more ambitious than the plan that Minister Dix and I were happy to announce 2 years ago. So where do we go from here? The plan is being finalized by Vancouver Coastal Health and the Richmond Hospital Foundation, and it's clear that these expanded projects will mean more care for people over a longer period of time, creating thousands of jobs in construction, as well as giving a clear signal to the people of Richmond that their healthcare needs, as they grow, one of the largest and fastest growing communities in British Columbia, as the people of Richmond see their community grow, healthcare services will grow with them. And we've been focusing on making sure we're connecting patients to physicians and primary care networks. One of the proudest components of the work that Adrian and I have been doing over the past 3 years is the establishment of 17 urgent and primary care centers right across British Columbia, and the creation of primary care networks. So we're connecting patients to the healthcare delivery that they need when they need it. I'm proud of the work that Adrian has done. I'm proud of the staff at the Ministry of Health and, of course, at the health authorities. And with that, I'm inviting, I believe, Dr. Ballum to come and tell us a little bit about how Vancouver Coastal got to the place where we can have this expanded tower with so many more services for the people of Richmond.
Thanks so much, Premier, and thank you, Minister, Natalie, and Richard. I'm just very privileged to be here speaking as the chair of Vancouver Coastal. And I just want to acknowledge that we are on the lands, the unceded territory of the Coast Salish, and we're very appreciative of their work with us. You know, building a hospital for the future is one of the most important things we oversee as a health authority. Richmond is a critical community in the Vancouver Coastal Health region. And it's just with great pride and a lot of appreciation for the patience of the government to have worked with us in the Health Authority, with all the staff and physicians and the foundation at the Richmond Hospital, to actually be able to take a bit of extra time to come forward with a plan that will truly meet the future needs of a community that, as the Premier said, is the fastest growing community in the whole province. It takes a lot of courage to actually look at a plan and say that it's not quite there, and then to have a government that's prepared to work with you to give you a bit more space and capacity to really make sure you get it right. And I just want to say how just incredibly excited I am that we're at this point here today. The contribution that you'll hear from Natalie Meixner, that the community has made to this, is just remarkable. And I just want to acknowledge our staff, Vivian Eliopoulos, our leader here, that has worked with many of the nursing staff, the allied professionals, the people who help keep our hospitals clean, the food services, and our physicians to just make sure we get this right. And as the Premier said, it's a bigger enterprise that we're going to build, but it is going to be really fabulous for the citizens of Richmond. So on behalf of the board of the Health Authority, I want to thank the Premier and the government of British Columbia. I want to thank the foundation and just say to the community of Richmond, we're very, very happy to have this occasion to actually share with you the good news of how this new development on this site is going to occur. So thank you so much.
I like that.
Good morning, everyone. Today is an incredibly joyous day for all of us, not only those of us here at Richmond Hospital, but for our entire community. Richmond is a vibrant, culturally diverse, and truly caring community. And we've certainly seen this over many years, but we've also seen it through the pandemic. Unbelievable support from every part of this community. Every cultural group has come together to support our frontline healthcare teams and buy the equipment that they needed and support everything that was required. At Richmond Hospital Foundation, we believe that joyful giving results in joyful living. And today is certainly a reflection of that. We're ecstatic with the Premier's announcement of an even bigger and greatly expanded Yurkovich Family Pavilion that will be built here at Richmond Hospital Foundation, Richmond Hospital. Dr. Anthony Yurkovich, or Dr. Tony Yurkovich, and his family graciously came forward very early on when we were beginning to fundraise for this project. He was a physician here for 40 years, so he was one of the first graduates of the UBC Medical School, and he looked after people in Richmond for 40 years, and he's been retired for 40 years. He and his family have a deep sense of passion for people here and for inspiring others who have joined them. We also want to thank the government of British Columbia this morning. Premier Horgan, Minister Dix, thank you. Thank you for listening so carefully to what the people in Richmond need, for taking action to keep the project moving and to get this building built. I too would like to extend our gratitude to Dr. Penny Ballum and to Vivian Eliopoulos and the whole Richmond team that's worked on this, the project team that are still working on this and that are going to make it a reality. These folks have put in hours and hours and so much thought into what's happening. Today's announcement also means that there are going to be even more opportunities for people in our community to play a role and to have a positive impact on the future of healthcare in Richmond. We're living in a new world. This is a new time. Innovation and technology need to be at the heart of this new pavilion, and I know that we all share the understanding of how important these expanded services will be for each of us, for our families, and for generations to come. So we thank our incredible community philanthropic leaders, the healthcare providers at Richmond Hospital and in the community, and everyone who is a champion for healthcare in Richmond. You have our deep and sincere gratitude. Thank you. And now I'm pleased to introduce Dr. Richard Chan. Dr. Chan has been an emergency physician at Richmond Hospital for more than 20 years, and he is also a board member, as you heard from the Premier, on the board of Richmond Hospital Foundation. Dr. Chan, over to you.
Thanks very much, Natalie, and thank you, Premier Horgan, Dr. Ballum, and Minister Dix for being here today. So today's announcement is an exciting step forward for healthcare in Richmond. Our community has long outgrown the aging facilities that we have here at Richmond Hospital. The rapid growth and development in Richmond and surrounding areas have placed an ever-increasing demand on essential medical services like emergency care, surgery, and diagnostics. In the emergency department, we've had a 40% increase in patient visits over the past 10 years. We now see approximately 60,000 patients per year. With steadily increasing demand, we are continually adapting our workflows to best function in a limited space. Our hospital is often at over 100% capacity. The new acute care tower will address our urgent need for additional inpatient beds and also address our need for single occupancy patient rooms. A new right-sized emergency department will be designed for function and efficiency to provide optimal patient care and will allow more patient privacy and enhanced infection control. A new and expanded medical imaging department will provide critical diagnostic tests and procedures to patients in the hospital and in the community. New surgical suites will be state-of-the-art, and expanded facilities for pediatrics and emergency mental health care will help us care for some of our most vulnerable patients. We have had tremendous support from the community and local businesses in Richmond. The COVID-19 pandemic, I think, has highlighted a need for modern, appropriately sized, and structurally sound hospital that we can depend on in the event of a healthcare crisis or a natural disaster. It has reinforced the importance of our hospital as a cornerstone of our community. I'm proud of the excellent team of doctors, nurses, and allied healthcare professionals that we have here at Richmond Hospital. The new acute care tower will allow us to provide quality, compassionate care, utilizing the latest in technology and innovation as we serve those in Richmond for decades to come. I want to thank the Government of British Columbia, Premier Horgan, Minister Dix, our leadership teams at Vancouver Coastal Health, our leadership at Richmond Hospital, and as well as my fellow team members at the Richmond Hospital Foundation, as well as all of our donors for their unwavering commitment to delivering a new hospital tower to Richmond. Thank you. We'll hand it over to Premier Horgan.
I think I come back, yeah.
You gotta come back. That's fine.
Okay, and I believe Jen is going to moderate the questions and answers. We have people on the telephone and a couple of people here.
Thank you to everyone on the line. A reminder to get in the queue to ask a question. Please press *1. If you've already pressed *1 to get in the queue, press it again as well. We are going to be doing one question and one follow-up today, and our first question is from Maria Rantanen from Richmond News.
Hi. So my question is first of all, the budget and the timeline.
Okay, well, the scope of the project has expanded over the past 2 years because of the dialogue and engagement we had with healthcare practitioners, as well as through the foundation, talking to the community about what was needed in the expansion of the tower. So with respect to finalizing the cost, I can say that it will be several hundreds of millions of dollars more than had originally been budgeted, but that will be finalized by September when we approve the business plan. In terms of construction, it will begin shortly thereafter with call for tenders and so on, and we're expecting, I believe, 2024 would be full speed. Is that correct? Yeah. So that's the plan as it is today. The final approval of the budget plan or the business plan rather, will come in the end of September. Then it'll be a component part of the budget with the new funding model in place, and then we'll proceed from there.
Okay, and do you expect any service disruptions?
Well, we expect fewer service disruptions, quite frankly, because of the expanded tower configuration. That was one of the significant concerns as we were going through the concept plan, was there would be challenges for the delivery of services while the tower was completed. So there will be, of course, a construction project, a major construction project like this will lead to some complications of delivery of services, but I'm confident that the physicians and the healthcare teams here at Richmond Hospital will do everything they can to continue to deliver the high quality of care that we've come to expect from this facility.
Our next question is from John Woodward, CTV.
Hey there. I guess I'll start with a healthcare question. We have just heard from the RCMP in Kelowna that they're looking at a system where a nurse would be on every single mental health call, and that's something that we don't have here in BC. And I wanted to ask the people there, including the Premier, what is the right way to handle these wellness checks from a healthcare perspective? And for the Premier, would you call for something like that to happen everywhere in the province?
Well, thanks for the question. We will be announcing, I imagine, early next week when the House reconvenes, the establishment of a standing committee of the legislature, all political parties participating in a review, the first review in some 40 years of the Police Act here in British Columbia. That will be done by legislators, and it'll be focused on how we can improve the Act to make sure that the delivery of public safety services is consistent across the province, of course, where we have municipal forces in some communities, RCMP and others. And it will more importantly look at how we can ensure that appropriate funding is in place for mental health services, for addressing other non-essential needs that law enforcement have found themselves doing over the past number of years. So our focus is on modernizing the Act, but that doesn't mean that we can't take action while that work is underway. And we're going to collaborate with municipal leaders as they look at the challenges and needs in their communities. If they have a police force of their own, like Vancouver or Victoria, or whether they have the RCMP providing services in their communities as they do in the interior, we're going to work with communities to make sure we get this right. I can't believe that we just can't allow this moment in time to go by. The public, the community want to have this discussion. That's the time to have it. We want to deliver public safety fairly, equitably, and without bias or prejudice right across the province. And that dialogue begins today, and it will be in place every day until we get it right.
John, did you have a follow-up?
Yeah, I mean, unless another mental or health professional wants to address that first one.
Do you want to talk to that, Adrian?
Yeah,
Sure.
we could. I mean, but maybe just do the follow-up.
Yeah.
You answered it well.
I'm getting, John, that's good enough from our side. If you want to ask another one, I'll see what I can do.
So the second thing that we're interested in here is that there's been quite a few reports of Americans who are supposed to be going, over the border and straight to Alaska, that they've been stopping in Vancouver, with some reports about, them stopping at a Vancouver hotel. I wonder what you'd say to that, and given the surge in cases in the United States recently, whether that's caught your attention in any way.
It absolutely has, and it's not just in Vancouver hotels. I represent the west coast of Vancouver Island, and I was speaking with the local chief of the Pachidat, and he tells me that there was a license plate from Texas and a license plate from California at the Port Renfrew General Store, and if you're heading to Alaska, you don't go through Port Renfrew. So we're concerned about this phenomenon, and we're hearing about it in communities right across the province. I've raised it with the Deputy Prime Minister, Chrystia Freeland, and I'm hopeful that she'll take this up with State Department authorities. We want to ensure that Alaskans can get home safely, but we also want to protect the work that all British Columbians have done to flatten the curve on COVID-19. And when we see outbreaks, and Adrian and Dr. Henry monitor this daily and allow this information out for the public to see, it's available, freely available. Outbreaks in Washington State, California, Arizona, Texas are absolutely unacceptable. We have to maintain our border security so that we can protect the progress we've made here in British Columbia. We do not want to make it more difficult for people to get home, but if you're going home, you should go straight home. You shouldn't be stopping along the way to enjoy the sights and sounds of British Columbia. That's not part of the plan.
Our next question is from Rob Shaw.
So Hi, Premier. There's just a lot of mention in the announcement of this hospital how important, the expansion is given the healthcare crisis we've just gone through. And I wondered, are you looking at kind of changing the way you budget healthcare funding because of the pandemic that we've gone through? There's always been this kind of governor on it because it takes up so much of the budget, more than 40% of the operating side. If you built all the hospitals we needed, the capital side would be full. But the pandemic's shown us the importance of making sure all of that is there in a crisis. So I wondered, going forward on the budget side, do you do anything differently when you look at healthcare because of the crisis that we've gone through or are still going through?
I would say, of course, we're looking at everything differently. It would be misleading to say anything other than that. But when it comes to this announcement today, we've been looking at how do we better deliver healthcare services in Richmond since we made the announcement of proceeding with the concept plan back in 2018. So we are always looking at ways to improve the delivery of services. Publicly funded, publicly delivered health care is the difference between ourselves and our cousins to the south in the United States. It's part of Canadian citizenship to expect and get delivered high quality public health care when you need it, where you need it. That means ensuring that the capital budget, and Adrian has been working particularly hard on this, hospitals in every corner of British Columbia, long overdue, Terrace, Fort St. James, Dawson Creek, just to name a few, the Cowichan Valley, of course, Burnaby, a second hospital in Surrey, as well as the St. Paul's replacement, which is a massive undertaking that Dr. Ballum is working on as well. So on the capital side, Rob, I don't think, other than making sure that we have a clear line of sight on ICU beds and how we would deploy those if we see a resurgence or a second wave or any other pandemic that may come our way. This is certainly a warning for all of us as citizens that we need to be mindful of how we interact with each other. And as government, we need to make sure that we're taking scarce dollars and putting them to the best use. And that's why getting it right at Richmond Hospital was so important. It would have been one thing to say, yes, we're going to plow ahead and we're going to turn ground and we're going to deliver the plan that was developed without the level of participation and input that physicians and other care providers here demanded. And that would have been the wrong course of action. So we changed direction because the evidence told us to change direction, and we're happy to do it.
And just on a different subject, could you give us your thoughts on the Supreme Court of Canada not hearing the appeal from some BC First Nations on the Trans Mountain Pipeline today? Is that the end in your mind of the legal challenges that are available to the pipeline, and what does this kind of mark in the long history of the opposition to that pipeline and the options available to you and others?
Well, certainly I'll leave it to the Indigenous nations that took the issue to the Supreme Court to comment on the ruling today. We did not participate in this. It was focused specifically on rights and title and how they had or had not been taken into consideration by the proponent at the time of the various processes that this project has gone through. From the province's perspective, I still maintain that Vancouver is not the ideal location for a diluted bitumen export terminal. I feel very strongly about that. The courts have said otherwise. The federal government has said otherwise. And so my focus now is to make sure that our coast has got every available protection in place for the increase of tanker traffic that will inevitably come from a completed pipeline project. And that means working with the federal government, who are now the proponent of the pipeline, to make sure that they understand that British Columbia has every expectation that every measure that can be taken will be taken to protect our coast and the economy that goes with that. British Columbians expect nothing less than that, and that's going to be my position going forward. Litigation is run its course from the province's perspective, but I'll leave it up to the Indigenous communities that are so fiercely opposed to this project to speak for themselves.
Our next question is from Camille Baines.
Hi, Premier. I'd like to know what the progress is so far with St. Paul's, which has been deemed unsafe for many, many years. It was last time you mentioned something about it. The project was to be completed in 2026. What's the timeline on that now?
Timeline on St. Paul's.
the timeline on St. Paul's is that we're right on time and right on directly working on our approach. There's other issues around St. Paul's or other construction that Providence Healthcare is looking at around St. Paul's and ancillary buildings. But the good news at St. Paul's is that we have multiple bidders and we're moving ahead and we're right on time. I think Providence Healthcare, with the support of Vancouver Coastal Health, is just doing an exceptional job on the project. It's obviously a high priority, as you know, and it's the reason why I think there may be concern around the project is that the first announcement on St. Paul's was made in 2002. So we're not making announcements every day, we're just delivering the project. And I think that's what people want, just as they want that here in Richmond. And I think in terms of Vancouver Coastal Health, these projects, Lionsgate, St. Paul's, which is Providence Healthcare here in Richmond, we're going to see in the Vancouver Coastal Health Authority modern hospitals that are going to take us decades into the future. So St. Paul's is on track. I'm delighted about it. Our partnership with Providence is strong. And in spite of all the challenges of the last few months, I'm feeling just fantastic about that project.
If I could ask a follow-up question, how will the budget, if it will be affected for St. Paul's, how will it be affected by the pandemic, and how many hospital projects are in the works now? There seem to be many of them.
Well, there are many of them. St. Paul's is one, of course. In Vancouver Coastal Health, you have the Lionsgate project, which is proceeding. You have this project in Richmond, which is just going to be extraordinary and has, I think, unprecedented support in the community. The Burnaby Hospital project proceeding, multiple bidders again. Where phase one of the Royal Columbian Hospital project is opening up and now open for service, providing mental health and addiction services in New Westminster. The second hospital in Surrey. The smaller projects at Langley, at Peace Arch, at Eagle Ridge, which is an emergency room project, which is just so important for the community there. And then in the interior, we're still we're doing Royal Inland, of course, a major and significant upgrade to the Kootenay Boundary Hospital and Trail. We've just opened Penticton, as you know, Williams Lake, Dawson Creek, Fort St. James, Terrace, Cowichan. It's a significant list with minor projects on there. And the reason for that is that most of our hospitals were built in the 1950s and 60s at a different time for healthcare. And this is particularly important for mental health and addictions. If you look around the province, those 50s and 60s projects present in a way consistent with the 50s and 60s. And the final thing is every one of these projects has profoundly involved Indigenous communities who have a different experience in those hospital buildings than other British Columbians. And so we want these hospitals to reflect a different approach. And these are the hospitals we need for the next 40 and 50 years, so we have to get it right.
Our next question is from Andrea Ross.
Hi, Premier Horgan. Ontario Premier Doug Ford said in a press conference that the launch of the Canada COVID-19 app will be delayed because the federal government still needs the go-ahead from some provinces. Is BC one of them?
No. British Columbia supports the national initiative. We, of course, have gone our own road on a number of initiatives, and we've seen success. Under the leadership of Minister Dix and Dr. Henry, we've been taking guidance as a government from our public health officials and charting our course based on that evidence. Whenever there's an opportunity to collaborate with other provinces and with the federal government, we've done so. And when there's an opportunity for us to speak loudly to the federal government about their responsibility on issues like the border, we were very loud. But there's no problem with the app from our perspective. Contact tracing and testing are a significant portion of the next phase of activity from public health. Dr. Henry is expert in this area, and I leave the negotiations to her, quite frankly, with public health officials across the country. But at the Premier's table, I don't see a problem, certainly not from British Columbia. There has been competing ideas about who has the best app, and I'll leave that for others to worry about. We're following our own course, and whatever the federal government comes up with in concert with the other provinces is fine by us.
Do you have a follow-up?
And as a follow-up, I'm just wondering if Minister Dix can answer in French.
Oui, on travaille fort avec le gouvernement fédéral. Dr. Henry est en contact et travaille étroitement avec Dr. Teresa Tam, qui est son collègue au niveau fédéral. Je pense qu'il n'y a pas de problème pour la Colombie-Britannique dans le développement de cette app. Il faut dire quand même que quand on fait des contacts et quand on cherche d'aider des gens qui ont vécu la transmission de COVID-19, le contact personnel est essentiel. C'est-à-dire que c'est possible d'avoir une app, bien entendu, et on travaille avec le gouvernement fédéral, mais force est de reconnaître que c'est des actions des gens qui travaillent dans le système de santé qui étaient essentielles dans le contrôle de COVID-19 en Colombie-Britannique. Et ça va continuer d'être le cas. On ne peut pas remplacer le rôle humain dans ce processus et c'est essentiel pour nous. Donc, le gouvernement fédéral va développer son programme, mais on va toujours travailler à fond d'assurer que les gens restent bien en Colombie-Britannique.
And we have time for one last questioner today, and that will be Keith Baldry from Global.
Thanks, Premier, for this. I just want to go back to the border issue. That seems to be an issue that's really increasing in scope in terms of people complaining about perceived border jumpers. In your conversation with Minister Freeland, did she offer blanket assurances that she's going to raise this with the Canadian Border Agency and ensure a crackdown?
No, I don't want to go that far, Keith. I just want it to be clear that this is an issue that's been coming to our attention from MLAs and community leaders across the province. We've raised it at the federal level. Diplomatic discussion is in order, and I'll leave it to Minister Freeland to pick her time and her place. As you know, issues in the United States are fluid, I think, if I could be charitable, and so I don't want to force her hand. She has been adept at working with the current administration in the U.S. to ensure that we're protecting the interests of Canada, and we very much want her to protect the interests of British Columbia, and she understands that.
And as a follow-up, I think the current border closure agreement ends on, I think, July 21st. Or is it your expectation that you will be hoping the federal government works to ensure that closure continues for much longer?
Every week, for 15 consecutive weeks, we have met as premiers and the Prime Minister and the Deputy Prime Minister, and for 15 weeks I have maintained, and others have supported me across the country, that our borders need to remain closed until the United States demonstrates that they have a handle on this pandemic. It's so critically important to British Columbia. We have worked very, very hard to get here. Frontline workers, healthcare workers have put themselves at risk to protect all of us, and we do not want to throw that away for queue jumpers, for people who want to say they're going somewhere and do something else. If you want to get to Alaska, we don't want to impede you, but you should go directly. Do not pass go. Go directly to Alaska, and we're going to be pretty clear on that right up to the next deadline, which is, as you say, the last week or second to last week in July. I can't see our position changing based on the evidence south of us at this point in time.
Thank you, everyone. That's all the time we have.
Thanks. Thanks, everybody.